Got my little sidekick Teo with me here today. I'm not sure why he's quite that bundled up. This is actually, can you say hi? This is the first day of official summer, and it's the first time here in the, oh, you gotta sit still and not climb on me, buddy, while we're doing this. Otherwise you gotta go inside, okay? Thank you. But this is the first time that it has actually acted like summer here in the Pacific Northwest. It's been the rainiest, grayest spring that we've had in a very long time here. So we got sun and it was like 70-75 degrees today, and it was just lovely. So finally enjoying being outside and enjoying the summertime. So I thought that since I've been documenting my whole breast cancer journey since day one here, I might as well add this in as well, even though we are 2 years out from me receiving my breast cancer diagnosis. If you want to go back and see the whole series, if you're new here, I can afterwards link a playlist in the cards here. Is it that side? I can't tell. This is mirror image when I'm going live. Yeah, I will link that playlist so that you can go back and see my whole breast cancer at age 35 story. It was definitely a shock at the time. Doesn't run in my family, whole 9 yards. It was definitely shocking. But just as a quick recap, if you don't know the story, I had invasive ductal carcinoma in situ, which means that I had one. Hi. I had two small tumors actually that had broken through. Okay, remember what I said, Betty. You're gonna have to go inside if you can't be quiet, okay? Mama. Thank you. But yeah, I had two small tumors that had broken through the duct's tail, and it had in situ, which means that it had spread pretty far throughout the ducts without breaking through. So it was actually pretty extensive to that when it came to the in situ part. So about a month after I got my diagnosis, I had a left mastectomy. And so I have been the one boob wonder ever since. So I've just been flat chested on that side and using a prosthetic on the left side. And I mean, not too bad, I'd say. Not too bad for being prosthetic, but it definitely gets annoying after a while having, this fake thing in your bra all the time. So, Teo, I think maybe you need to go inside. No. Okay, then you sit on your blanket. Thank you. Thank you. So, yeah, so I had mastectomy in, April of 2020. And this was right after the pandemic started, and I had to go through all of this stuff by myself because they weren't letting, at the time, anybody into the hospital. So I couldn't have my husband with me, parents, anybody. It was quite an ordeal, but it's all documented if you want to go watch that on my playlist. So anyway, and then I found out after they did the biopsy, well, not the biopsy, I had already done the biopsy, but the pathology, that's the word. When they did the pathology of the tissue, they had found that I had the type of cancer that I needed to have chemo to prevent it from spreading any further. Like if any of the cells had escaped, it wasn't likely because they had tested my lymph nodes and my lymph nodes were unaffected, thank God. It hadn't spread that far, but they never know for sure if there were just some rogue cells that could have escaped. And so they said, well, you're gonna have to do 4 rounds of chemo. So have that whole chemo documented journey documented in the playlist as well if you want to see that, and losing my hair and that whole ordeal. This is 2 years of hair regrowth, and I've gotten 2 haircuts actually. So it's actually probably would be down to about my chin without any haircuts, but I've just been evening it out. It was getting kind of shaggy down low in an uneven way, so me and Bill kind of evened it out a little bit. So that's what 2 years and 2 small haircuts looks like at this point. So anyway, so I wanted to talk about, now that we are 2 years out from receiving my cancer diagnosis, that I decided this summer would be a good time to get my reconstruction surgery done. I didn't have it done at the time just because of everything with COVID going on. Like, most of the time, under normal circumstances, when people have a mastectomy, they get their reconstruction done like either at the same time or soon after having their mastectomy, like within a few months or within a year kind of thing. But with COVID and having 3 young children and homeschooling, and last year I had a hysterectomy. You can also pull that video up if you want to see my whole hysterectomy journey. So I've had a major surgery every year since 2020. This will be my 3rd year in a row that I've had a major surgery where I am removing a major organ. So I had a friend joke that I am KonMariing my reproductive organs. I am getting rid of what I don't need anymore. And I am done having kids, and I don't need any of them anymore, so they served me well. I'm glad I was able to have that experience, but now it's time for them to go. So I'm down 1 boob, I'm down a uterus. Now I'm going to actually have, I should explain what exactly the surgery is that I am having now. So I am having a second mastectomy. They said that I could have kept my right breast, but I chose, after a lot of thought and prayer, I think I actually needed the full 2 years to come to this conclusion. I don't know if you're gonna need it, Betty.
The sun's too bright.
Okay, go get your sunglasses then. Sun is setting, but he wants his sunglasses. So yeah, I had to decide whether I wanted to keep righty here or if I wanted her to go as well. And it was a hard decision for me to make. I mean, just because I feel like, you know, I've lost so many other body parts that make me a woman, you know, that it, you know, it's hard to lose that last one, you know. But my logic and reasoning is that even though because I had chemo and I've been on tamoxifen, which is a hormone blocker, an estrogen blocker, since my cancer was estrogen positive, I've had it, it makes my odds very low of having recurrence. But even still, now I am 38, and I still have my whole life ahead of me. And like, I have 3 young kids. I have a 9, 7, and 4-year-old, and I just feel like I can't take that risk, however small, because the risk was tiny of me getting cancer in the first place. So, I mean, like, really tiny, but it still happened. So, like, what are the chances? Like, knowing my luck with my health history and everything, you know, I feel like I just don't want to play roulette with that, and I just want to ensure that that is no longer a risk. So I made the decision that we are going to do mastectomy on the right side as well. So that will be part of the surgery. I am working with 2 surgeons, the general surgeon who will do the mastectomy, and then the plastic surgeon who is going to do the reconstruction aspect of it. So there are 2 options when you are doing breast reconstruction. You can either do the silicone implants, or you can do what they call the flap, reconstruction where they take fat from your belly and literally move it up to where it needs to be. And you basically get a free tummy tuck out of it. So it's not exactly a tummy tuck, but it's similar. And so I was like, well, this decision seems pretty easy to me. I had my pre-op with the plastic surgeon, and he was saying that, especially given my age, doing the flap surgery is a better long-term option because, I mean, hopefully I still have another 50 years ahead of me, and I need it to last. And a lot of times, the silicone implants cause other problems in people down the road. And so I really wanted to do what is going to last. It also just looks more natural. It feels more natural. It doesn't have any sensation because in the mastectomy, they remove all of your nerves, but it is vascular, meaning they connect your circulatory system to the tissue so that it is fully connected to the rest of your body. So it's just overall the most natural option that you can, not that cutting off body parts is natural, but like as natural as you can be in doing a reconstruction. So that is what I am planning on doing. So yeah, I'm going to be going in mid-July, and that will be, I decided in terms of homeschool that maybe I'll make a homeschool video about our summer plans, but we are continuing to homeschool through the end of June, and then we are going to just take the whole month of July off. For one, we're going camping before my surgery, and two, I'm having a surgery. And I'm going to be in full recovery mode because it's an involved recovery. I know what's involved with the recovery with the mastectomy since I did it on the other side, and it takes a while, and you have to regain. We are gonna go camping. You say hi.
Hey.
But yeah, it's involved, and you have to carry a drain around with you for a while, and you have to regain your whole range of motion in your arm because it affects your ability to move your arm up and down. Fun fact, I used to be a massage therapist, and I did a medical massage for a while, and so thankfully I know how to do a lot of massage that you would have done in massage therapy if you were getting that done post reconstruction or post mastectomy, so I can just do that on myself. And last time I took a picture of it and put it on social media, but after surgery I could only pull my arm up to about there. Okay. And then after all the massage and the stretching and everything, then I could finally get full range of motion with my arm. So I plan on doing all that again the second time around on the other side. So it will definitely be an involved process. So I'm definitely for a month or so, well, at least for a couple of weeks, we'll be in no shape to parent, let alone homeschool. So thankfully we have so much family. If you have been watching our vlogs for any amount of time, you'll know that we are very close with our families, and they both sides live in the area, and so they will be here to help with the kids while I am recovering and while Bill has to work and that kind of thing. So yeah, so that is the plan, Stan, and I'm looking forward to being done, like completely done with this whole process. It's been 2 years of crazy. It's just been truly like everything involved with the pandemic, plus all of my surgeries and health issues and cancer. Everything has just been a crazy, crazy 2 years. So I'm feeling like this is going to what?
I left one gate.
Oh, okay. Are you a cool little guy?
No.
No. Anyway, so I forget what I was saying. This little guy distracts me all the time. But oh, I was saying that I am really looking forward to just having this whole process be done. This will, you know, kind of be the bookend of the of this process. Okay, buddy, go ahead. And so it will, you know, after one surgery after another and chemo, and just it's going to be so nice to be done. So nice to be done. And praying, always appreciate prayers that I don't have any sort of recurrence anywhere else in my body. I had my annual checkup with my oncologist just this week, and you know, he always has to tell me like the things to look out for in case of recurrence, even if I have a double mastectomy, you know, like if it's spread elsewhere in your body, symptoms to look for like bone pain and things like that. So the odds are minuscule, especially when I get a double mastectomy. But I do always have to have that in the back of my mind. Just be aware, be vigilant. Okay, good job, buddy. You can go find Daddy.
After close the gate.
Okay. So yeah, I'm hoping this is the last surgery that I have for a very, very long time. I mean, who knows, maybe I'll have minor surgeries, but I'm hoping this is the last major surgery that I have in a very long time. So yeah, that is pretty much it. That is what is going on, and prayers appreciated for a smooth surgery and recovery and all that business. And it will be happening in mid-July. Oh, somebody is on here asking what kind of reconstruction. Oh yeah, I talked about that earlier in the video. I'm getting the flap reconstruction type, where they take fat from the belly and move it up to reconstruct new breasts. So that's the kind I'm getting. So yeah. So do you guys have any more questions or comments or anything before I sign out? I always want to check when I do these lives just to make sure. I always you know, I've actually done most of my cancer updates as live, because then I don't have to go back and edit, and I can just put it up there and go, and it's done, and then I have my video up. With my busy life, that's how it has to be sometimes. So anyway, all right, well, I'm not seeing any other questions or anything.
I don't see Daddy.
You don't see Daddy over there? Okay, well, we'll go look when I'm done, okay?
He's at work.
Okay. Oh, you had yours done 6 months ago. Yeah, the IEP flap recovery results are, oh, that's wonderful. I'm so encouraged by that. I just love hearing other people's stories and hearing that it's gone well for so many other people. That's just wonderful, and gives me a lot of hope that this will be a really good outcome long term. So anyway, I hope you all are doing well, and that you all have a wonderful summer. And I will look forward to seeing you guys in the next video. Oh, it says, I'm a nurse and have taken care with many DIP patients. Oh, that's great. Thank you. That's wonderful to hear. Do you guys want to say goodbye?
Bye.
Bye. All right. Well, thank you guys so much for watching, and we will see you guys in the next video.
Edit,
Bye.
please.
All right. Bye.
I said because I said to edit the video.